A COVID surge is happening across the country as the Omicron variant spreads. The CDC says the average daily number of new COVID cases is surging to more than 176,000 people. That's the highest it's been in nearly a year. It can be seen here in New York State with more than 26,000 new cases being reported yesterday. Testing is also up. More than 5,000 people are being treated for COVID in the state. Still, nearly 70% of all New Yorkers are fully vaccinated. It's a spike we knew would arrive, particularly after the holidays, and now workplaces could soon be faced with a wave of sick calls. Medical experts anticipate even more infections as we come out of the holiday season. Jack Watson is here in studio with more. Jack?
John, it's not just the cases, it's the hospital numbers. This is a pretty sobering comparison as we learn the amount of people in the hospital statewide from the governor today. Last week, about 4,300 people in the hospital. Today, that number is about 5,500. So hospital numbers jump up about 1,200 in just a matter of days. All of this to say COVID is spreading rapidly, and now that we have the Omicron variant in the mix, it is seemingly spreading easier than it ever has. There will be, of course, a ripple effect. Our local businesses have suffered staffing shortages for months now for a variety of reasons, and folks not feeling well and having to call out sick could make things even worse. I caught up with Chamber of Commerce CEO Bob Duffy just a few hours ago. He says the last thing businesses need right now and the last thing the governor wants is another shutdown. Folks calling out sick could especially hurt small businesses.
The impact could be, certainly not much for a large business. It could be devastating for a small business. And we're already in a staffing crisis as we speak. It's very hard getting people to fill the jobs that we currently have. So as they test positive and they can't come to work, or you don't want them coming to work, that really does exacerbate the staffing problem.
Duffy also urged following masking and vaccine guidance. It should also be noted healthcare workers coming back to work are coming under a new set of criteria for those who test positive. Among other things, the isolation time is shortened from 10 days to 5 days. The acting health commissioner said they are not advising sick people to return to work, but they called the new criteria sensible. John.
All right, Jack, thank you very much. New York is also seeing a rising number of children hospitalized with COVID-19. During Governor Kathy Hochul's COVID briefing today, we learned 70 children were hospitalized statewide the week of December 5th to the 11th. So that number went up to 184 during the week of Christmas, yet vaccination among youth remains low. Only 16% of 5 to 11-year-olds in the state have completed their vaccine series. Governor Hochul said while this number is going up, we're definitely not where we should be with it.
Parents, I'm calling on you. This is the time. You have the kids home from school. There's plenty of vaccination opportunities, from your pediatrician to a site set up by the state of New York, our urgent care centers, so many places, drugstores, where you can go get your child vaccinated before they get back to school. Please do this for them.
Although most of the hospitalizations among kids have been in New York City so far, health leaders say it could be a trend we see in other areas of the state. Children 5 and older have been eligible to get the Pfizer vaccine since early November.